question for, first of all, I use, oops. Oh, good, my stumbling is gone. I use ride sharing all the time, love it, use it all over the world. But once I started on this committee, I started thinking, well, how do we know, I don't mean, this sounds bad, but I don't mean, I just want to know. I would like to know, now I'm thinking about it, how do I know that my driver isn't impaired in some way? And maybe it brings in, now you need maybe I should jump in, have the guy blow in a BAC, but do you do anything to monitor your own drivers for alcohol abuse or use? They don't have to be abused, using when I get in the car.
So are you asking if we require, like, I guess, a BAC check before they're able to, like, log onto the app?
Well, I
Or
would just like to know how I can be sure that my driver is not impaired in some way. And since we're talking about alcohol, I'll ask it with regard to that.
so part of the screening process for being able to, be permitted on the app is that they do a background check and screening. So having like a DUI is a disqualifying piece of criteria. I think that that other feature is that unlike other forms of transportation, you're able as a rider to give feedback on your driver. So if for some reason you suspect that that's the case, then you're able to report that in. And we have community guidelines that state that driving under the influence is definitely a disqualifying and will remove you from the process. So there's a process in place for them to check and verify that claim. And then if it's proven to be true, then you lose access to the app. So there is a check and balance in place in that regard. I think in looking at like the broader picture and the like larger, there is, conversations about whether that's going to become like standard equipment on automotive vehicles. And if that's the case, you'll see that stuff kind of like rolled into the fleet naturally because we represent the average driver, so all those things are there. But that's how we approach it there. It's definitely included in the screening process and is a part of our community guidelines. So our partners know that it's not permitted. It's a zero tolerance of sorts.
Yeah, and same with Lyft. It's part of the it's part of the education. When the driver comes in for onboarding and education, they receive that information that they're not allowed to be driving impaired, alcohol or otherwise. And then the peer-to-peer review, right? The passenger rates the driver after the after the ride. Anytime there is any indication that a driver has been drinking or is impaired in any way, there's an investigation, and that driver is typically offboarded.
Okay.
Joanne?
I had my hand up.
Okay, got two more ahead of you, Ricardo.
Okay.
Sure.
I have a question for Keith about Backtrack. I'm pretty familiar with PBTs. I was a prosecutor for a long time, but I'm curious about the calibration of your instruments and the life of them. So when would someone know that time to change the battery, time to get a new unit, whether it be your little small one, your new watch, or the instrument they're using to connect with the app?
Sure, common question, great question. The technology has come a long way, so the lifetime of a device and the sensor stability is actually years. So we have devices out there that we'll get back for recalibration after 4 or 5 years, and they're reading perfectly. We do recommend people can send it to us for recalibration once a year. We do have many people that do that. The people that need to know within a very tight range what their BAC is, they will do that. But the fuel cell technology, it does last for a long time. It's very low power consumption. So does that answer your question?
Yes.
Okay.
I asked that so just as a quick follow-up, is the cost associated with the recalibration borne by the company? So if I send it back to you, am I paying a fee to recalculate? Or recalibrate, excuse me?
It's not a profit driver for us. It's a service we provide. In a lot of cases, we see people that after 2 years, they just upgrade to the latest model year, sort of like cell phone. Every couple years, people get a new cell phone. People will buy the latest and greatest. But that is either $19.99 or $29.99, including return shipping back to the customer. So we will test it in our lab, look at the results, and send it back. And again, I think people are used to the law enforcement standard where that has to be lawyer proof. And that needs to pass, all types of questions. The standard is a little lower. We still have a very, very high standard. It needs to be highly accurate if people are making decisions. But within those calibration guidelines for law enforcement, those are not realistic on the consumer side.
So I have Charles, Kit, Ricardo, Carrie, and David.
So one of the things that I've studied over the years is the development of alcohol tolerance. And I think it's confusing to the general public who don't look at it the way I do, that there's something magical about zero point zero 0.08 or zero point zero 0.05. And in fact, these are just numbers that have been correlated with a degree of impairment. But there's huge differences based on genetics and experience and other things you mentioned, food. But the point is that people can have the exact same blood alcohol level and still have very tremendously different amounts of impairment. So you're not really measuring impairment with your device, but it's very good. I mean, I'm not criticizing it, but I just think that it's an opportunity to study tolerance and learning. And I wonder whether this huge amount of data that you have, is there any evidence that people get better at predicting what their level will be? And because, some people are really good at picking up subtle signs of impairment at a very much lower level. And also, another question that I have is that you have the ability to give the push notifications to people when they're in a danger zone. Do you have any evidence that giving them that information changes their behavior? Do they then stop drinking, or stop driving? But so in other words, there's a modification of behavior that can come about because of this information.
Your first comment on impairment is, of course, dead on. 0.08 is a common standard, and that's sort of the best number we can put forth that applies to everybody. But we see with our devices, and I've seen it personally many times. In fact, I'm thinking of a specific instance over 4th of July. I can't go to a party without friends and people asking, hey, do you have a backtrack? Let me test it. And it got passed around. Everybody blows into it. And the one quiet guy picks it up, this device. His wife was right next to him. And he blows into it, and he was talking, and we were all hanging out 4th of July, and he blew a 0.22. And so when you talk about impairment and tolerance, this is somebody who's a heavy drinker that was having a normal conversation way above 0.08. And those are the people that probably, when they go out, they drink to 0.20 or 0.22, and then they get in the fatal accident when they're 0.40. So the very heavy binge drinkers. So we have that data. I guess your second question is, do we have evidence of actionable actions where we can deter that type of behavior? We do not. We would like to get into that with partnerships, with researchers. There are tremendous opportunities. We just haven't gotten to that point yet.
Ken?
This question's for Keith. What's the timeline for the wearable coming to market? And then second question is the timeline for if you anticipate these devices being integrated with vehicles to the point that you could maybe change behavior before getting into the car.
I'll take the second question first. The vehicle integration with the onboard diagnostic ports is a very exciting area with interlocks with criminal justice offenders. If you've had a DUI, that prevents you from driving. Highly effective. However, that's a real pain for those people. You get it installed, you have to find an installer, you go back every 30 days, get that calibrated. That's a real effort. With an onboard diagnostic plug-in, connects via Bluetooth. Everybody has a smartphone now. Everybody has a data plan. That result can get sent to anybody, a parent, a monitoring group, anybody out there. So if we had more budget and more dollars, we're a modest size privately held company, we'd be on that right now. Instead, we're doing the remote alcohol monitoring, the handheld devices, and the wearable. So Kit, you asked about the wearable. We are working very hard. We are getting prototypes and advanced prototypes to researchers soon, and we will be getting this out to market. I'm trying to think of what I can reveal publicly. We will be getting it out to market as soon as we can.
Very politic. Ricardo, are you there?
Yes, I am. I appreciate it. Thank you. The quick question I have is really thanks to all three of you for great presentations. But for our colleagues from Uber and Lyft, there's really kind of two different groups out there in a way. One is the urban, and the second is the rural. And the rural crashes are, single vehicle, longer two-lane highways, that sort of thing. So how much in terms of Uber use or Lyft use or for this sort of alternative, how much penetration there is in the more rural environments?
I'll start. This is Steve from Lyft. I'll start by saying that right now in the partnerships we have locally, not much. And I think that's probably just symptomatic of the fact that the rideshare use case is most prevalent in the downtown market. All the zip codes in the RAT partnership I mentioned, all the pickup drop-off zip codes are within the city limits, or most of them. And you're kind of getting out to Courthouse and Roslyn and Arlington area, but not much out here to Manassas or Loudoun County. I think that's the next iteration of this program is really making sure we're not just exposing to, but targeting specifically the more rural counties here in the DC area and nationally as well. I mean, the majority of our partnership efforts are happening here in the DC area on this topic, which is why I'm speaking specifically to this partnership. But I think overall, whether it's Austin, Texas from a year ago or San Francisco, I think we all want to make sure that we're hitting the rural areas because we're seeing the same thing.
And just to add on a little bit to that, I think it's an area where we're seeing increased interest. I was at the Lifesavers Conference in Charlotte this past spring, early, it feels like a while ago, but I had plenty of people from local law enforcement from very small rural towns looking to learn more about ways of partnership and whether they could work with Uber to get the promo codes or just inform people that it was an option. You see the same thing happening on a lot of colleges and universities where Uber is available, having interest from the colleges, kind of doing a hub and spoke type of idea where they know that their students coming in and out and traveling around, seeing if there's a way to kind of partner and work together to let them know that Uber's available if they're going to and from games or activities that may be a little further off campus, and then being there to provide a ride home and not to drink and drive.
And one more thing, and this is Nadia and I both mentioned this, but partnerships is really probably the best way to reach those folks. We're speaking, Lyft is speaking with Loudoun County Tourism Department about getting out to the wineries. So outside of the city, in those rural areas, speaking specifically with the wineries and making sure those folks are again not just exposed to Lyft, but encouraged to take rideshare when they're going back to their hotel or back to their homes after drinking.
Did you have something else to say, Ricardo?
Thank you. No, good, thank you.
Good. So I have Carrie, then David, Kit, and Jody.
Thanks so much. I had a question on the Backtrack device. I study mostly adolescents and young adults, especially college students, and I hear their voices as I'm hearing you talk. And from what we're seeing for adolescents and young adults, pre-gaming, drinking games, and coerced drinking is increasingly a major issue for young people, and I could see them using the Backtrack device as a game. How high can I get my BAC up? I don't want to leave for the party until my BAC is 0.1. And it's sort of this unintended consequence to encourage more binge drinking than prevent it. And is that a concern, or is that part of the discussion at all? It's only a safety measure if people are using it responsibly, and young people historically do not use alcohol responsibly, and therefore I would imagine don't use alcohol devices responsibly.
That exact question I fielded at every single retail store buyer meeting, from Best Buy to Costco to Walgreens. Every single buyer said, isn't this just going to encourage people to drink more? And here was our reply, and I'll give it to you now. First off, people have been drinking irresponsibly since the beginning of human beings. There's the drunken monkey hypothesis and how apes evolved drinking alcohol and how humans started drinking. So there's been a long history of alcohol abuse. I can venture a guess that people will continue to binge drink for a long time into the future. We argue, and we've actually observed, and we have data that shows that, let's say a bunch of teenagers are pre-gaming, drinking heavily in college before a football game. If there is a device there and somebody happens to blow into it, at least there's a number. At least somebody could say in the back of their mind, if they don't say it publicly with peer pressure, wow, I know that we are 4 times the legal limit. It might not change behavior. They're going to drink with a breathalyzer, they're going to drink without one, but at least there's some actionable data that you can't ignore. And so we're big proponents of that. Let's get it out there. Let's have more information. Let's not sweep it under the rug. Let's talk about it. Let's have products available. Anytime we're talking about the devices, we're talking about blood alcohol content. We're talking about safety. So we think it's a great thing, but we're biased.
David, what are your biases?
Well, so mine is a bit of a follow-on. You started at the beginning of your presentation talking about what you were like at .07. And do you have any data that shows that this device may actually be encouraging people to drink right up to .08 when impairment can start much lower? Does this, point up perhaps, insufficiency of .08 as a standard, since you yourself said you were impaired at .07? Does your app have any kind of warning bars or anything that start below .08, .04, .05? Just can you speak to that a little bit?
Yes, moving the BAC limit from .08 down is something that many people are considering. I know Utah was in the news recently for considering that. I think that this committee will consider that topic. That's a very important one. The most common thing that we hear, and especially from females, when we're getting customer feedback and people send us reviews, people will often be surprised, wow, I had 2 drinks and I reached the legal limit. I had no idea. And it's because, are you talking 2 drinks of Bud Light? Are you talking 2 drinks of 2 vodka tonics that were over poured?
2 drinks from a bartender who really liked you.
Exactly, exactly. So that's a common piece of feedback that we hear. And so again, this is educational. People will say, wow, I had no idea. I thought with this drink chart that 2 drinks I was okay, when really they learned from that. So we think that's a benefit. And again, we try to be very clear in all of our marketing. In the instruction manual, on the packaging, and in the app. You asked, what do we do? And this is another amazing thing by having smartphone connected devices. We make use of the smartphone screen where we can have these big clean messages that say, you're impaired, your motor skills are impaired. Those are actual messages that show up in the app when you are impaired.
When do they start?
They start we have different messages at every level. So typically from 0 to .02 is the window where DOT uses that. You're allowed to be in that level. Above that, we start to say, hey, things are happening. You're feeling differently. We're educating people. And we call it our flavor text because we added a little flavor to just a number. We say, hey, here are the skills that are off. This is what you're feeling like now. It sucks people in. It could just be a boring number. Hey, you're a .05. But no, we want to make it clean, appealing for people to use.
Kit.
This question's for our ride-sharing folks. It seems like the community partnerships are pretty promising. How do those get launched? Is it initiated by the community? What's the funding source for the promo codes, and sort of what are the barriers to? I can imagine that there are a lot of townships out there that might want to replicate the findings in New Jersey. What are the barriers to scaling up more broadly?
So the partnerships are kind of go both ways. So if we're working in an area and we notice that something's happening or that we're outreaching and engaging with the community and it's an issue that's brought up, that's something that they say is going on, we figure out ways to work. It's mostly handled. There's a national partnership that we have with Mothers Against Drunk Driving, but then a lot of our local teams work at the community level with stakeholders who either they're familiar with or with local law enforcement. And that's something that the promo codes, the local team takes on that cost. They figure out some innovative ways to get them out into their hands. For example, in Seattle, our local team there has a great relationship with law enforcement. So they go out to bars together where law enforcement will say that we have a checkpoint planned for this day, and there are people there from Uber to give promo codes and give them to the bartenders behind. Like if you notice someone possibly needs a ride home, here's a discounted ride or a free ride home, or to be able to say that Uber's an alternative and provided promo codes that way. So it kind of goes both ways. And then we also get a lot of incoming from other local community groups who are interested in learning ways to partner more and understand the way that we can work together, so they outreach to us as well.
In similar to Lyft, there's our Anheuser-Busch Budweiser partnership is run by headquarters, and local teams, local markets run their own regional partnerships as well. With the RAP, the Washington Regional Alcohol Program partnership that we have here, Lyft pays for all new user coupons, and RAP, which is a 501c3 funded by coincidentally, Budweiser, Enterprise Rent a Cards, Geico, AAA, several private companies, they pay for the existing user coupons. And so I think the largest barrier, well, two things. One, to echo what Keith said, awareness, awareness, awareness. Really, the biggest challenge I think that we collectively have is making sure people are, one, aware of rideshare, and then two, are then using it. And then the second part is funding, right? It's always about who's funding the rides, how are we funding the rides, how much are we funding these rides, do we need to fund rides for existing users? Are people going to use rideshare anyway? So why do we need to really pay for those rides? So I think if we could tackle the awareness issue first, we could then worry about the funding issue second.
Jody?
I had a question, or two questions for Keith. One of them is, you mentioned, I'll tell them both. You mentioned schools. I'm just interested in what you're doing with schools. I've worked with Yale trying to get the drinking down from very high. I don't know if you've had any discussions with schools how to help in that way. And the other thing my follow-up question was, when I get into Uber or Lyft, how do I know? I remember wasn't it the police officer or someone said they had an ambient air measure? So I'm wondering if you have any ideas of ambient air measures, so I could get in I'm not so worried as I sound, but I'm just on this committee. Get in the Uber with my ambient air measure and say, oops, I'm getting out, cancel, or get into Lyft. Thank you.
Sure. First with schools, about 10 years ago, when our products were really showing up online and people started to started to be aware that breathalyzers existed for consumer use, we had just a rash of high schools and even middle schools that would contact us, and they would purchase them and start testing students before a prom, before a dance, before football games. And they told us they went from having to do the smell test with students, where they would literally get near them and smell the student, to having their own device. And then if there was a positive on a device, that again is $100, not expensive for a school district to equip every school in a district with one, then they could call in law enforcement, get a device that would be lawyer-proof or parent-proof in that case. On the university level, again, we have student advocacy agencies and health groups at universities that are purchasing products. Those are not active partnerships that we have. The second question was about the ambient device. We do not currently make one. That's typically been obviously a zero tolerance type device. Law enforcement, I know there's a flashlight where they can shine it in the car and then that picks up ambient air. We're more of a consumer products company typically, so we haven't done that. They're not difficult to make. If you're still questioning, hey, how do I know if my ride-sharing driver isn't impaired? This is a little self-serving, but we have that remote alcohol monitoring service where every ride-sharing driver already has a smartphone. They already have a cell connection. They already have a display on it. All they need is some software and a device in their vehicle. And then anybody at headquarters in their local region could hit a button or set up a test schedule, and that driver would have to blow into the test. They'd be video monitored, and that result would get sent back and verified. In fact, I follow Uber Engineering on Twitter, and I think that they use some technology to identify that the driver who's supposed to be driving that car and using that service is actually that driver. So the ride-sharing companies are already doing recognition of these people. So maybe we need to have a conversation, off camera here, but there's an opportunity to integrate alcohol testing.
How many fatal crashes in the last several years were the result of Uber or Lyft drivers?
Good question. I don't know.
So, just to follow up to these sort of related technologies, and I realize that they may not be part of what you're doing. Are there peer groups that are actually looking at measures of impairment on devices rather than specifically the alcohol content? And similarly, are there devices coming on the market that detect other drugs that are obviously of concern?
There are other devices that are detecting other drugs. They're not widely available for consumers to just go and purchase and remotely monitor. And the first question again?
Well, so impairment really is a matter of physiologic function.
That's right.
Are there any devices coming on the market that are actually looking at your behavior? As we talked about, and Charles raised earlier, people are impaired at different levels to different degrees, that actually measure skills and function rather than, chemical measurements.
Yeah, I'm having a flashback to a product design meeting where we thought about doing that. In fact, we have some IP that relates to performing certain tasks and how that relates to your BAC. And so that can be done. One of the reasons why we didn't do that, one of the several reasons why we did not, was because people who have built up a tolerance and who are alcoholic or go through life and they're a 0.20 just when they wake up, they can often pass those tests with flying colors. So we were sort of afraid of showing something or demonstrating that, hey, this guy just blew a 0.25 and he's fine. He should be on the road, and the 0.04 person should not, because that person's unsafe. So you get into these tricky issues about who should be on the road and who should not.
Yeah, those are public health issues, obviously. David, and you'll be the last one for this round.
Okay, question for the ride-sharing folks. So you've heard Keith say he's got this technology available, technology's getting much better in general. I'm kind of with Jody about your drivers and about your companies taking the lead. Given that technology is available, would your companies be willing to take the lead and set the standard and require this of your drivers?
We'd be willing to have a conversation. I think we've had similar conversations with companies with safety cameras, for instance. It's a safety concern. Drivers and passengers are in a car together, an incident occurs. How nice would it be to have a camera to record the incident? And typically what happens is the issue ends up being cost. So who's paying for it? And then accountability. What happens if and when, let's say, the driver uses the system that Keith has, and there is an accident, and come to find out that the driver was impaired? Where does liability fall? Does liability fall with us? Does it fall with them? And this question, I'm in operations and strategy. That question falls on my legal team and my policy team. I defer to them on that. But I think that those are just two of the roadblocks that we've seen with similar devices.
And just to echo and chime in a little bit on that as well, it's kind of a question for me of what is it that we're trying to solve for as like a member of the safety community? So if you look at the number of people, the number of total drivers out on the road and those who actually use their cars part-time for ride sharing, what are you trying to get at? Are you trying to inform the public about the dangers of doing this? Or are you trying to have an impactful thing where you actually figure out ways to remove those people who may be impaired from getting off of the road? And if it's an educational situation where you're trying to collect data and research and understand like the average person's driving patterns and habits and how they think about it, they may be something worth like exploring and talking a little bit about. But if you're trying to get into the portion of, are you reaching the most people who are like at risk of doing this or at risk of being behind the wheel as a drunk driver, there may be some other innovative ways to kind of use the Keats technology in order to get at that. I think there are some interesting things that the ride sharing community can do, and there's ways to talk about ways that we can help reduce impairment, be it through alcohol impairment, or even as we see growing numbers with like cannabis becoming legalized in certain states. So I think there is a role that we can play there, but I think that education, outreach, and providing people with an alternative to behavior that they've been doing in the past is probably the more impactful way at getting at like reducing those numbers and taking more potentially impaired or drunk drivers off the road.
Well, great. Well, thanks to all three of you for a very interesting discussion. I appreciate your coming here this morning. And now we'll take a brief break. We'll be back at 10:30 for a more discussion of alcohol policy. So thank you.